Hi, it's Dr. Ann Zink, and today is December 23rd, and providing a brief update with where we're at with COVID-19 in the state of Alaska. On this slide, you can see overall our graphs. We can see our onset date, our report date, our percent positivity, as well as the total people in the hospital with COVID-19. We, in general, have been seeing a decline in the onset date as well as the report date of number of new cases, although the last 2 days have been slightly higher than the days before that. Today, we did have a total of 355 new cases. And unfortunately, we do have 3 new deaths to report, all of which have been recent. Thinking about their friends and family, particularly this holiday season, who they've left behind, we do know that hospitalizations and deaths tend to lag behind numbers, and that's why it's really important that we keep pushing those numbers down to really prevent people from being hospitalized as well as succumbing to COVID-19. It's been fantastic to see our percent positivity starting to decline as well. We're hovering just below 5% at that 4.91%. And again, love to drive that down even lower, making sure that we're doing adequate testing. We have had a significant decrease in the number of tests that have been done in general, and encouraging anyone with even the most mild symptoms to get tested, being tested before and after travel, or anytime you've gathered or been with others, realize that that is a higher risk event and consider getting tested somewhere between 5 and 10 days afterwards to see if you've been exposed during that time. Again, we'd love to identify asymptomatic cases as well as mildly symptomatic cases early so you have the power and knowledge to not spread it to others. Our hospital capacity remains adequate. About 10% of our patients right now in the hospital are there because of COVID-19, and there's been a slight decrease in that. We've had a total of 943 people who've required hospitalization during this pandemic. And unfortunately, during this holiday season, today we had 13 new hospitalizations, and just hope everyone in the hospital has a speedy recovery. And thanks to all the healthcare workers, EMS, and service personnel working around the clock and throughout the holiday to keep people safe and healthy. Our contact tracing team will be working throughout the holiday, as well as our lab team. On our data dashboard, the numbers won't likely be updated on Christmas Day itself, but we will be sending out a summary of them just because of the IT infrastructure that it takes to update the dashboard itself. Moving on to our next slide, here is where we're at with vaccines. Again, we're at this point with very limited availability and trying to get it out as quickly as possible. On this next slide, you can see the total number of doses that have come into the state that we are responsible for helping move around. This includes both our state allocation as well as the IHS allocation. It does not include the DoD and VA allocation. So this includes just over 35,000 Pfizer doses and over 26,000 Moderna doses. And again, trying to get it out across the state. The tribal allocation includes 11,700 of those Pfizer doses and 8,900 of those Moderna doses. This is one of my favorite slides to look at the number of people who have actually been vaccinated in the state of Alaska. So as of yesterday, we had 8,918 people who not only received the vaccine, but then the information had been reported back to us. And this includes 8,886 Pfizer and 52 Moderna. And the Moderna had just come in recently within the state. We'll continue to report those out as we get those numbers in, and you can see them on our vaccine dashboard. We're currently working through phase 1A, tier 1 and tier 2, and soon we'll be opening up to tier 3. So tier 3 includes workers in healthcare settings at highest risk for contracting COVID-19 who are essential to healthcare infrastructure and regularly provide healthcare services that cannot be postponed or provided remotely. And you can see the full criteria on our website. This will be by appointment only, and the appointments are first come, first serve. Vaccination clinics will be posted on our CovidVax and the CovidVax.Alaska.gov website, including scheduling links, and scheduling will go live December 30th. So again, if you are an outpatient healthcare clinician who cannot postpone or delay and needs to be able to see people in person, we'd encourage you to take a look at our website December 30th to sign up for a time near you to get vaccinated as part of Tier 3 Phase 1A. The actual vaccination process, however, will start January 4th. Moving on to the next slide, here's where we're at with kind of determining these phases. I think it's really important to emphasize that this is not based on importance. This isn't based on how much someone matters. We all matter, and people are so important to this response. It's really looking at 3 different fundamental key components. It's looking at the science behind the data, it's looking at the logistics of making it feasible, and it's also trying to get equal outcomes for people across the state, regardless of age or location. And when we talk about the data and science, we're trying to do 2 things. We're trying to decrease the morbidity and mortality, the chances that you get ill or you might die of COVID-19, and making sure that systems are in place, making sure that our healthcare systems are in place and other critical systems are in place to make sure that there is healthcare and other systems in place to be able to support people. We are currently working, as mentioned before, through this phase 1A. The national ACIP recommendations did come out regarding phase 1B as well as phase 1C. Our allocation advisory committee is working through that process right now to kind of figure out what's the best way to do that. Are we going to do another tiered process or open it all up and first come, first serve, kind of within that phase 1B section, and making sure that it fits Alaska? We do really look forward to your public comment. And so there is live public comment that will be taken December 28th. And please sign up here. You can see on our slide here how you can sign up to be able to provide public comment. You can also provide comment in written form if you can't attend that time. And you'll also hear an overview of where we're at with the COVID vaccine allocation process at that time. And again, we'll continue to move through those steps as quickly as possible. We'll want this to be a transparent process as we move through the steps. Again, here is our kind of our balancing act between the Alaska Vaccine Allocation Advisory Committee. Again, looking at the science, the implementation, and the ethics of it. Again, that science of maximizing the benefits and minimizing the harm of vaccination, prevention of morbidity and mortality, and preserving societal function, implementing it, ensuring feasibility of vaccine distribution, and community and individual values, and then ethics, achieving equal distribution and outcomes for Alaskans, and ensuring transparency and promoting education on both the science and implementation. So those are kind of the founding guidance for both the ACIP and for ours. One last comment about safety. There's been a bunch of great safety questions out there. We have had some reactions that we do believe are adverse reactions. Continue to try to get those out on a regular basis. These are actually reported to a separate system called VAERS, which the CDC sees, and then we get those reports back from them. Both us and the CDC are working on a best way to report those on a regular basis. And we're working with clinicians to make sure that they have the tools and resources that they need to support patients in case they do have an adverse reaction, as well as being able to document it early and often. And we actually sent out a clinical update today talking about the labs that we're requesting to be drawn if someone does have an adverse reaction, so we can better understand the nature of these adverse reactions. So lots of information there, and I really encourage you to take a look at the VAERS website if you have more questions. But in the meantime, we have lots of great tools. Mitigation works. I've been talking a lot about how we've done a lot to get to this point in the season, and we're moving through the winter solstice. The days are slowly starting to get longer. So as these days start to get slightly longer, let's really, for this next couple months, do it for our children. Let's get these numbers down so kids can be in school. Let's be able to do it so our teachers can teach safely. Let's do it so our businesses can be open, and let's do it for each other as Alaskans. This is the time of giving. And so let's not give COVID. Let's make sure we check on each other, take care of each other, work together. These next couple of months will be a big turning point for the state. And we really appreciate all of your partnership. So with that, happy holidays. I hope that you stay safe and you be well. Again, our dashboard won't be updated on the 25th, but we do have our emails that will continue to go out and continue to post on social media and other places around. We are here and continuing to work, and appreciate all of your patience and time as we move into a new season. Thank you so much.